Suzie, nice to see you again.
Hi, Lori. Nice to see you too.
It has been a long process. I think it's been a total of roughly 6 months-ish now. And 3 months where you were actually involved in a more intensive rehab program. So just give me a little rundown about some of the progress that you've made.
Well, I feel like I've made leaps and bounds as far as my recovery. I've had much relief from many symptoms. I've had complete resolvement of some symptoms. And I feel like I've just been really fortunate to be able to access care because, as you know, it's really difficult for people to gain access to doctors and clinicians and people in the know of what to do with long COVID.
Yeah, I feel long COVID is a situation right now that the healthcare crisis is going to be under because they don't have service, they don't have enough access to service and funding, which you obviously know well aware with all of your COVID groups. Out of the practitioners that you were seeing, maybe just give people a quick rundown of who you're actually seeing.
Right. So I was seeing an occupational therapist, you.
Myself, that's correct.
And a physiotherapist, Jenna, and an acupuncturist, a naturopath, a speech therapist, and counseling. I found great relief. I'd never seen an acupuncturist before, but I found really great relief with the neurological symptoms that I was having as far as the tinnitus, the brain fog feeling of having sort of peripheral vision, not really focusing well.
What would you say to other long haulers? So there's lots of people out there that who don't have access to services. And you and I talked about, and you kind of helped spark the idea of the online virtual group program, which has been a pretty good success. But a lot of people don't know about services like that. A lot of people can't access hospital services. Like in general right now, we're playing catch up. How do you see this whole scenario?
I see exactly as you are. I think it's unfortunate that there are a lot of clinics actually that are helping long haulers, but they're not as versed as you've been treating long haulers for over a year now. And we're finding that some of the clinics are actually promoting physical activity, maybe when people aren't ready to do so. So I think people need to be really careful in figuring out whether a clinic is going under the right practice and guidance, unless you can actually come in person, and like I did for the 3 months and had hands-on, which was, for me, is the most beneficial, is going to be the most beneficial for anyone. So if you can't afford to do that, and if you have coverage, I strongly suggest going in person, getting some services, you know, and also having that whole, what's it called?
That whole person approach, right?
Yes, exactly.
Yeah. I mean, at this stage in COVID, we don't have, you know, a pill or a specific treatment to make it go away, right? So our main knowledge is how do we treat the symptoms and get people more functional. So that's why we do the whole person approach. There's a lot of self-management strategies, but also research is changing all the time. So unless you're on top of it, and you know well because you do lots of posting of new research, which is amazing for people to access, but unless people are reading that research, constantly implementing it, the care that people are given is kind of all over the map right now.
It's very piecemeal.
It is, which is unfortunate, but I'm glad you were able to participate in the research study because it just gives us more information to be able to disseminate to others of how you could potentially treat and help somebody. The one thing we have remaining with you is redoing the Vox Neuro assessment to see.
I just wanted to add something, is that the speech therapy was wonderful and really gave me focus in certain directions, as well as the naturopath put me on supplements that really helped heal my gut issues. As well as the counseling really helped me to calm and to zen and to really calm down the vagus nerve.
Wise. Thank you so much for participating, and thank you for everything that you're doing for the long haul community. I know that without all of that work that you've put into, half the people that are suffering right now would have no direction at all. So thank you for participating in the research, and thank you for what you're doing with the long haulers.
And thank you for what you're doing for the long haulers.
Good team.
Thanks, Lori.
All right, thanks.